Dilshaad Ali, who is Group Chief Executive Officer of the Hoan My Medical Group in Vietnam, to bring an international perspective on transformation and setting up an accountable care organisation. So, Dilshaad, I can hand over to you.
All right, thank you, Mark. Just as a background, I had experience running healthcare transformation in Saudi Arabia as well, so very familiar with the NHS model, and happy to be here today to share my thoughts. My role currently is to run a private healthcare institution in Vietnam, the largest. We have 21 healthcare assets across the country. We see about 5 million patients a year, and obviously the population of Vietnam today is about 100 million people. And surprisingly, when I saw the slides from John, Alder hires 4,000 people, and Hoan My, as a system of 3,000 beds, we have 5,600 employees within the system itself. Carl, next slide, please. Right, so a snapshot, I think very importantly is for us to understand while we try and drive value and look at performance and look at efficiencies in the system, understanding the future is important. So Vietnam in a snapshot, today or last year had 103 million people, growing to 105. We see aging being obviously a part of the whole growth of the country. And of course, their life expectancy increases as well. Most importantly, of course, is the income that we see growing over the next 7 years, and healthcare spending in line with how the middle class is created in the country, which is at frontier at this point of time, continues to grow, while we see affluence rising and the middle class of 48 million people become 56 million people within the next 6 years. Next slide, Carl. So when we look at performance and we look at efficiency, as I said, we're challenged from a point of view of not having enough talent in the country when it comes to healthcare especially. But I guess the biggest blessing that Vietnam has is that it's one of the highest countries in the world where there is high penetration of internet and digital technology. And today, Vietnam has an average of about 2 cell phones per individual in the country. And it runs one of the highest e-commerce or social commerce penetration in the world when it comes to interactions on retail, and obviously with healthcare as well. It's become an interesting revolution where the country stands to gain from creating accessibility for healthcare across 100 million population altogether. Next slide, Carl. So Hoan My is 27 years old this year. Started off from a small clinic, servicing individuals who were seeking healthcare post-war Vietnam, and then slowly grew into a system of secondary care hospitals across the country, and then diversified into clinics having a single line of care, which was secondary and a little bit of primary care in its system. So when we looked at the value proposition of Hoan My, and as Sir John Mayer said, moving from 2D to 3D is very important. Developing the omnichannel was essential in the sense of how we now spread out efficiency in the healthcare system, not just looking at performance and cost, but also looking at how we can increase accessibility across a country that has a growing need of private care, or a care that needs to be complemented by a system that's now subsidized by social insurance, and also looking at the healthcare spending of the government, which is obviously continuously increasing, but not being able to cope with the rise in demand. So Hoan My moved into diversifying or breaking up its healthcare offerings, and we went right down into understanding what the future would look like, how people would perceive healthcare in terms of accessibility, and most importantly, using the right resources at the right point of care to ensure that we're not going into a waste situation where tertiary hospitals are looking at very low-level primary care interventions, or replacing primary care interventions or specialty care with digitally accessible platforms that would then allow patients to get into the system without us looking at a high resource component in terms of delivery. Next slide, please, Carl. So what we did was we created a different approach towards how we look at different segments of people who come to us. And very importantly, segmentization was key, because then you look at affordability and you look at ratios in terms of manpower distribution in a healthcare system. You look at investments from a capital expense perspective, where equipment are now segregated according to the needs of the outlet or the point of care within the omnichannel. And most importantly, creating downstream, upstream service outlets which run on value and which run on return on investment. So if you look at the world of Hoan My today, which wasn't existent till about the end of 2022, we've diversified ourselves into obviously the premier side of care, but most importantly focusing on the middle class segment, which is the flagship brand, and then looking at the affordable care, which looks at about 40% of the population of Vietnam today, to continue our role in terms of complementing public care, and then utilizing the same payer system as the public is using, which is the social insurance of Vietnam itself. Now, a very key initiative that we had, or two especially, or three, in fact, was to create the academy. In an environment where there is a shortage of talent, it was very important for us to keep the pipeline running, where we keep continuously producing healthcare leaders and healthcare clinicians as well, to ensure that we are sustainable. The second one, of course, was the digital platform Yan which allows us to penetrate into 90 million people across the system who can access us remotely and gain care from our system itself, reducing our requirement to place resources and also to build brick and mortar facilities in terms of capex that we were going to be spending in that sense. And of course, the third one was the labs, where scale was important. And as most countries are regulated, similarly in Vietnam, hospitals are required to have in-house labs. What we've done is we've looked at the lab system itself and now created a value stream within the labs to look at retail and in-hospital lab systems that would then spread out the scale and give us the value of the economy altogether. Next slide, Carl. I think one area which we really had to address was the shortage of talent. And the most important part was developing partnerships, which we have already done over the last 2 years or so, Strasis included, that we bring in knowledge from abroad to deploy into Vietnam. And of course, learning from both the successes and the challenges that the partners have had in their own evolution and their own journeys. And then, of course, localizing these experiences to set up clinical centers of excellence and looking at how we can deploy more competent and more efficient healthcare systems within Vietnam itself. I think that's the end of my little brief on what we've done from a private perspective in a frontier country. Obviously, the opportunities for us are great in the sense of creating a value-based system that allows us to deliver more economic and more efficient care to the people while we don't compromise on outcome. Thanks very much.
Thank you very much, Dilshaad. Now, they say creativity loves constraints, and obviously you've faced several constraints there you've talked about in Vietnam, but you are countering that with creativity in terms of the omni-channel work that you're doing, also what you're doing with labs. I'm wondering if you could have, just given what you know of the NHS and your exposure to the NHS as an organisation, what do you see as sort of some of the common challenges in terms of workforce, in terms of funding, that are constraints between those healthcare systems? And what lessons do you think can be learned both ways, from NHS to Vietnam and from Vietnam to NHS?
Thanks for integration. And this is beyond just from a private perspective. It is where a system has to be completely integrated, seamless in that sense. Silos obviously have to be broken. We see the same thing in my journey towards transforming what we have in Hoan My today. And I guess similarly where the NHS journey is at this point of time, the breaking of the silos is very important. So integration in the form of not just governance, but breaking down and integrating care is key. The most significant lesson we've learned, not just from a business perspective, not just Hoan My, but from Saudi Arabia as well, is the design or the architecture of the healthcare continuum has to be really solid. Second point is obviously there are disciplines that we need to go through and follow through in the sense of ensuring that that design is maintained. And obviously, change is a constant, and making sure it evolves, it localizes, and it is flexible enough for us to change as per the demographic needs and, of course, the needs of the organization itself. So these 3 points relate closely to what NHS has been going through and what I see as being lessons I've learned myself, looking at what the system is, being exposed to Saudi Arabia, and then, of course, now bringing this to a market where it's one of the largest populations in Asia, and we're basically seeing similarities between the both.